there. My name is Brooke Adams, and I have prepared a presentation entitled Mandating the Shot a Second Look. And within this presentation, I'm going to address some of the issues that my debate partner cited as reasons why healthcare workers should not be required to get the COVID vaccine. And I'm going to be proving those reasons as inappropriate. So let's go ahead and get started. So in my partner's debate video, they said that healthcare professionals undergo extensive training regarding how to prevent the spread of germs or other infections. According to Johns Hopkins Medicine, healthcare professionals are trained on standard precautions, and a component of standard precautions is hand hygiene. So it's important for us to have a working knowledge of what hand hygiene actually is. And that's just the cleaning of hands by whether you're washing them with soap and water or using a hand sanitizing gel. It's important to recognize as well that it's the number one way to prevent the spread of germs or to prevent infections. So this is just implying that healthcare workers need to be practicing hand hygiene very frequently throughout their shifts to provide for the best interest of their patients. Okay? So let's take a look at some of the moments for hand hygiene. In an article by Concordance Healthcare Solutions, it states that hand hygiene with an alcohol-based hand sanitizer should be completed several times throughout a healthcare provider's shift. And perhaps it should be before touching a patient. It should be after touching a patient, after contact with the bodily fluids, blood, or shared surfaces. And hand hygiene with soap and water should be completed when arriving to work, when hands are visibly dirty, when caring for a patient with a known or suspected infection, as well as when leaving work. However, it's important to recognize that this is not an inclusive list of every time throughout a shift that a healthcare professional might need to wash their hands. These are just some definitive things that should be going on within their shift after completing specific activities. So let's take a look at implementing the training that healthcare professionals have regarding hand hygiene into their personal practice. So a web article published by the Centers for Disease Control states that there's a lack of hand hygiene measures being practiced among all healthcare professionals. So healthcare professionals have been noted to practice hand hygiene less than half of the times that they should. And healthcare professionals may need to wash their hands as many as 100 times per 12-hour shift, depending upon their patient ratios. So this is basically implying that healthcare professionals might further be contributing to the spread of infections or diseases because they're not washing their hands enough. However, it's difficult for them to, whenever they need to wash them so often throughout their day, since they're providing direct patient care almost the entire day. Especially since the COVID infection has become prevalent in our society. Many healthcare professionals are getting more patients than they would have before COVID-19 became prevalent. So just for reference, let's say there's a nurse working on an ICU unit. Before COVID-19 was prevalent, they might have cared for 1 to 2 patients a shift. However, after COVID-19 has become prevalent, they might be caring for 3 to 4 patients during their shift. So obviously their workloads increase, they have more expectations, they are expected to meet responsibilities, and it's difficult for them to get it all in a shift. So in an effort for them to get everything they need to into a shift, they may need to cut out activities, and unfortunately that may be cutting out practicing their hand hygiene. So let's take a look at some of the factors affecting the implementing of the training regarding hand hygiene practices into the professional's practice. So a research journal by Endell and others states that healthcare workers cite 3 reasons primarily for why they are not practicing hand hygiene as much as they should. 66.3 state that they just do not have time in their shift. 88% state that their hands are just not dirty. And 86.6 state that their patients get offended when they see them practicing hand hygiene. So these statistics are clearly stating that even though healthcare professionals have the knowledge of the importance, there's clearly an issue with implementing it into practice. And I feel strongly that that could be due to the healthcare professionals' inability to comprehend the significance of hand washing to provide safety for both themselves as well as for their patients. Okay, so based upon upon these things, I feel like it's still very important for healthcare professionals to still be required to get the COVID-19 vaccine, because clearly we're lacking. We're not able to provide for our patients like we were prior to COVID-19, and safety is still the utmost importance for all of our patients, and I feel like in an effort to provide for their safety, we need to be regulated to get the vaccine. So here I've incorporated a reference pages of where I obtained the information that was presented within this presentation. Feel free to take a look at it. You can fact check me if you'd like. And I also want to take a moment to thank you for watching my presentation, and I hope that this helped expand your prior knowledge on hand hygiene as it relates to healthcare professionals spreading infections.